So Preservé is kind of a clever way of saying preserve. It's a new way of doing breast implants that you're preserving the breast tissue. And it turns out that the breast is sitting on top of the pectoralis muscle, and in between is the pectoralis fascia. We've been putting implants in different planes of dissection. Initially, it was put in the subglandular plane, and then years later underneath the fascia, and then years later we're putting it under the muscle. And there's some disadvantages of all of those placements, but specifically for under the muscle, it hurts more, and you'll have some type of animation. When the woman moves, the muscle will move, and it looks kind of artificial. So with Preservé, you're now putting the implant in between and inside of what's called the circummammary ligament. It turns out that there's a ligament that attaches the female breast to the chest wall and keeps it so it doesn't migrate laterally or downward or upward. So by putting this implant surrounded by this ligament, it's kind of in a privileged position that can do what it does to make the breast look bigger with smaller size implants. And now the implant doesn't of necessity have to be centered on the nipple anymore. So if you're missing more upper pole fullness, which most women after babies are, you can now put this implant more preferentially upward and augment the top part of the breast and not necessarily as much of the bottom.